Ladies and gentlemen, I'm going to tell you something very important which is called as the vertigo and tinnitus. This is a common problem faced by the humanity. People used to come from everywhere. I have worked in MAYO hospital, you can see the photograph it. It is the oldest hospital and oldest department in this region, made by the British government at that time in 1870. Very old institution. Along with that, King Edward, you can see King Edward Medical College, they made in 1860. And in that there is a main block, Patella block. I am walking with the principal of King Edward Medical College, Professor H.N.S. There used to be a lecture there, and I used to deliver the lecture to the students of MBBS on vertigo and tinnitus. Vertigo is a very common symptom, especially in the older age group. And tinnitus, listening of the unorganized sounds in the ear. Situation is quite tricky, very difficult to treat. There was, a state-of-art lecture in first National E.N.T conference also. I went to the Ziaul Haq Sahab, the President of Pakistan and Chief Martial Law Administrator, the strongest man of the time in Islamabad, and I requested him to come and inaugurate this first event of E.N.T conference ever in Pakistan. No E.N.T conference took place in Quetta, Peshawar, Karachi, but the first time in Lahore. It's a big, breakthrough towards the scientific, work. There was no forum for the E.N.T surgeons to work on the scientific, grounds. But here in Lahore, this is the Hilton Hotel where President Ziaul Haq Sahab is sitting, then Federal Minister of Health Dr. Nasrullah Rana, and I am addressing the audience. It was the first step in Pakistan. Then second was when I organized the third SAARC E.N.T conference. It's the mega event of the medical history of Pakistan. Also in SAARC countries, because the first SAARC it took place in Dhaka, then in Kathmandu, they were the smaller, events. Less people were there, but in Lahore, it's a very, very charming city. People used to come from everywhere, because Lahore used to be called as the city of school and colleges. The first medical college, the Punjab University, oldest university. It used to conduct the examination, even the metric student of New Delhi. They used to come and have the examination here. Then this medical college, first dental college, first veterinary college, first even mental hospital. It's also in Lahore. Lahore was the main seat. Then after the second was in New Delhi. All the people used to come for education. Like this Government College Lahore, where I did my FSc, to get admission to the King Edward Medical College. It is again the institute at the Asia level. Very old and a great institution from where the people used to get education. And I joined this King Edward Medical College due to my marks which I obtained by doing FSc from Government College Lahore. You can see this graceful building. However, then I am going to talk something about this tinnitus. Vertigo, a patient, when vertigo and tinnitus, mostly they go side by side, but sometimes there is a tinnitus, sometimes there is a vertigo. Vertigo, patient when gets up from the bed, he feels that he is going to fall. He feels that the world is moving. It's a very difficult situation. Sometimes the people, they come with a fracture of leg, fracture of their arm, they just fall down. In the same way, tinnitus is very bad. It's the listening of unorganized sound in the ear, especially at night. When everything sleeps, then the patient of tinnitus, he then faces the music. I tell you very frankly, TV is off, there is absolute silence. Then there is a big problem in the patient. Patient says that at night, when I wanted to sleep, I could not sleep. These are the two situations. But however, I represented Pakistan in New York in the World E.N.T conference. You can see me standing with delegates which came from Italy, from Germany, from even Japan. They read the papers how to manage. This is management. There are some 2-3 clinics in New York. On the name was Balance and Tinnitus Clinic. I went there. They have put the latest machinery. Where they are doing a lot of good work. It's something new. And they told me about 4 years back that there is a masker or masking device just like this, which I'm going to show you this. You just put it in the ear of a patient who's having tinnitus. He become okay. Because the medicines for tinnitus people are taking from years and years. Surgery, it is written, is always disappointing. No need to go for surgery to the tinnitus patients. This is a simple, very simple and easy way to manage, to control the tinnitus. And also patient gets stable. This is the place where in New York, near the Manhattan, Jacob Convention Center, where this conference took place. You can see my photograph with Professor Jennifer, who's the world authority of the ear problems, and she is in charge of house clinic there in Los Angeles. And then I went to, Egypt, in Cairo, again another World E.N.T conference, where they said that we should use the masker. This is small, just like hearing aid. You just put in the ear of the patient becomes okay. Mostly patient, they are benefited. Before it was just beating about the bush. There is no proper medicine, no proper surgical procedure, but this is simple and safe. You can see this is my E.N.T clinic on J Road, Lahore, Pakistan, opposite Kinnaird College. I am giving the service to the masses. The people come from various districts, even from abroad. Somebody is coming from Dubai, somebody is coming from Muscat, from Saudi Arabia. And we are doing a, good job for the E.N.T, specialty. I will tell you very frankly, E.N.T is a very special specialty which deals with so many senses. I have read a paper there in Delhi, New Delhi, during the 5th SAARC E.N.T conference also about this tinnitus problem. Tinnitus, we should deal it, try that we can handle the situation by, again I will show you this small masking device which will make the patient comfortable. Thank you very much.